Hi guys, welcome back. In this video, we shall be talking about radiation. And whenever we're talking about radiation, it's all about the nuclear weapons. Now, since you know that there is a tension going on between Russia and Ukraine, and there is a chance of use of any nuclear weapons. Yes, obviously the chance is low, but it's not zero. So there is a chance of nuclear weapons, right? So we need to understand what is the symptoms and what are we supposed to do in case if we are getting exposed to radiation, and what are the preventive steps that you can take, right? So whenever you're talking about radiation, there are a lot of units in order to tell what is the unit of radiation, how much been you have been exposed. So I'll try to make it a little bit simple here. So we're going to talk about rads, rads. It's a unit of radiation. In very simple words, what is rad? It means amount of radiation that has been absorbed by living body, like the amount of radiation that is exposed by human body, right? So and what is the full form that is known as radiation absorbed dose? Now just to give you an idea, around 100 unit of rad is equal to 1 gray. These are all units. I'll just try to make it very simple. Okay, all right. So just to give you an idea, in 1 year you have been exposed to around 0.6 rads per year in by your daily activities, maybe from your sun, maybe from your household activities. Normal that you have been exposed by this. Now whenever there is a nuclear reaction or blast or nuclear reactor meltdown or a bomb explosion going on, so what is the damaging unit? Now the damaging unit that we have to understand, if you've been exposed to around 50 to 70, around 50 to 70 rats, if you've been exposed, so that time you might be having nausea, you might be having vomiting, you might be having weakness. And another thing that you have to understand is that if I have been exposed to radiation for a long time but it's in a small dose, right, one situation, or another situation is if I'm been exposed to radiation for a very short amount of time but in a high dose. The second option is more worse. I should not be exposed to radiation in a high dose in for a very short amount of time. Acute exposure of radiation is more dangerous than chronic exposure with very less amount of radiation. Obviously any amount of radiation, try to limit as much as you can, right? So just coming back to the normal, the value that I was talking about is if you've been exposed to 50, around 50 to 70s, yes, nausea, vomiting, might be weakness, might be there. This is normal. That is, you should be recovering from this fairly easily if you are kind of relatively fit in a good health status, right? The another exposure that I want to tell is around if you've been exposed to around 70 to 50, 70 to 150, sorry, 70 to 150. In this, you will be having again nausea. You might be again having vomiting. Again, weakness might be there. You might be having bleeding, might be there. Okay, occasional bleeding might be there in this case. And definitely, yes, this is also you will be recovering from this relatively better. The another thing that is very important is if you have been exposed from 150 to 300 units, right, 150 to 300, this is more dangerous. Now you will be having fatigue, you will be having weakness, you will be having nausea, you will be having vomiting, right? You will be having delayed wound healing, right? You will be having bleeding, you will be having burns. Obviously all these symptoms will not be present in all individuals, right? If you have been exposed to less amount of radiation, not the entire group that have been exposed to this will not have the symptoms, and the more amount of radiation that you have been exposed, more severe will be the symptoms, right? That is what I want to tell you. The another thing is around 500 rads. It's very very dangerous. If you are having 500 rads of exposure, the people that will be dying is around 50% of people exposed to 500 rads will die. You will be having severe amount of diarrhea, you will be having nausea, weakness, vomiting, burn. You will be having loose motion, including blood mixed with this bloody stool will pass out, right? This is very very dangerous, and you will be having a case fatality rate of around 50%, right? And almost all the patients that has been exposed to around 500 units will be having all the symptoms, right? And if you have been exposed to around more than 500, it's almost around 100% sure that you will be dying. You will be again having all the symptoms that I have told you, right? So how this is this is the symptoms that you know that you have been exposed to all this thing. So what can you do at your level for a consumer level, or like a normal day-to-day person that can do in their daily routine. First thing first, please try to understand whenever there's a nuclear bomb explosion, you have certain amount of time to escape that area, right? You have certain amount of time to escape the area. It is always dose dependent, and the amount of exposure, time that has been used, that is also very very important. Let's say there is a nuclear explosion near my place. What is the first thing that I should do? Whatever clothes that I'm wearing, if I'm wearing the t-shirt, I'm wearing my pants, I'm wearing a cap, I'm wearing gloves, I'm wearing sunglasses, anything that I'm wearing, I have to immediately take it off and throw it as fast as possible. That means I have to go completely naked. I should not have any kind of cloth in it, right? And I have to immediately rush to the shower to take this thing, take a shower, take a bath with soap and water. What is the main goal? Let's say my hand, this hand is exposed now. This hand has been exposed to radiation. This should not go inside my body. That is the main goal. Let's say my hand is exposed to radiation, and I should not lick my hand, or I should not eat without washing my hands very properly, or there should not be radiation going inside my body through inhalation. So that is the important thing of immediately dumping out your clothes and immediately going to the shower to take a bath very nicely with soap and water. This will limit the amount of exposure to enter, the amount of radiation to enter inside your body. Yes, obviously you will be having surface exposure, but we want to reduce as much as possible it's going inside your body. This is very 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 important, right? So that is one thing. And second thing, let's say if some of your family members or your friends or your relative, anyone is exposed to these things, you have to take care of them. Again, same procedure. You take out the clothes, give them a very good bath, and then take care. What are the cases that you need to take care, right? You can be having cases of burn. You have to manage the cases of burn. They can be having a lot amount of pain. You have to give painkillers. There can be burn dressing. You have to do the burn dressing. You have to take the painkillers. You have to give them. They might be having a lot of loose motion. You have to stop that. You have to put hydration solution. You have to give ORS solution. IV solution has to be given, right? Along with this, you have to see for the patient who might be having a lot of nausea, so he might be vomiting, so you have to suppress this vomiting. And also very very important, you have to give very good amount of nutrition, because the patient will be very very weak and the wound healing will be very less. You have to make sure anywhere there is wound, there is injury, right? You have to keep the area very very clean. So this is how you can take care. And if you can know the symptoms, and if you know how much amount of radiation exposure has been done, you can take care in this way. Please try to note this, that let's say there's a radiation exposure today. Just after 24 hours, after 24 hours, the radiation exposure level in the environment is reduced up to 1/10, right? 1/10. So the main goal is that you have to be very very safe for the first 24 hours. That is absolutely very very necessary. Yes, definitely you can go up to 72 hours, but first 24 hours is very 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 vital, right? Because the radiation exposure has reduced to a very great extent. We are not talking about if some place there is leaking going on, continuous exposure is going on, the amount of radiation in the environment will not come down, right? If there's one sudden explosion, the amount of exposure will come down in next 24 hours to about 1/10 of the initial dose, right? For that thing, you can have radiation monitors. If you don't have, you should be using your local radio. You should be listening to your local radio operators. They are very experts. They'll tell you when it is safe to come out of your hiding location. Now, very important, where can you hide in the first place? First thing first, if there's an explosion, get away from that as fast as possible. As far as possible, the amount of exposure time has to be reduced to a very great extent. Less amount of exposure, very good. Less amount of time exposure is very good. More distance from the source of exposure to more distance place is very good, right? If these things are not possible, how can you prevent the exposure in the first place? Anything which is solid, this wall is solid material, like block of cement, a block of concrete, block of steel, block of lead, these things will actually reduce the amount of radiation passing through it. So just to give you an idea, if you have a thick block of steel, container, something, let's say around 12 inches, 12 inches or around 24 inches, it is going to reduce to a very very great extent. Or if you have the solid block of concrete like around 24-30 inches, right, it is going to reduce the amount of exposure to a very 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 great extent, like 1/4, 1/6, right? Exactly, I don't remember the exact formula how much thickness will be reducing how much amount of this thing, but more amount of thickness is going to be good. Definitely not everyone is going to have an ability to have containers of steel, but if you have a container of concrete, if it is around 24 inches to around 30 inches, it's going to reduce the amount of exposure to a very 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 great extent. Yes, obviously it is very difficult for you, to construct a house that is having a around 30 inches of cement block or concrete block complete. I'm not saying telling about the hollow concrete. It has to be complete 30 inches, 24 inches to 30 inches of complete concrete. This is not very possible. So that is the reason you should be knowing if your place, the place that you are, let's say, you are having your residence, is it having any nearby bomb shelters or nuclear fallout shelters. This is very very important. So if you know that, you should immediately rush to those areas. Worst comes to worst, if you know that you are in a building or you are anywhere that you cannot hide out, the worst thing that I can tell of, if you can use your soil to a barrier. So you have to increase the amount of soil for around like 1.5 meters. So around 1.5 meters of soil, uh, if it is there between you and the outside environment, it's definitely going to reduce the amount of exposure to a very great extent. Obviously you have to do this preparation beforehand, like if there's an explosion and you cannot start to dig a hole in the earth and then go inside, it's not possible. So the more thicker the more better. So I would suggest, if you can actually search up in online exactly what is the thickness of what material will give you how much amount of exposure. I don't remember it, uh, please pardon for it, but more denser the material and more thicker the material, less amount of exposure you'll be having from the radiation. So soil is very good, but the best one is lead. Second best thing I can think of is steel. The next one is very practical, that is your concrete around 30 inches. Let's be safe, around 30 inches. And if you cannot have that, if you have the soil, that is also going to reduce your exposure, right? So this is being in consumer, being in like in the lower level of the entire things going around you, being just a common man, and you don't have your nuclear fallout shelters or this and that. These are the things that you can do beforehand. Like you could invest having a bomb shelter or a nuclear fallout shelter. This is, the chances are low. It's very expensive, I do understand, but it's the way it is. So we don't know what is going to happen, right? So that was a small video about radiation exposure. And yes, prevention might not be possible all the time. If you're prepared, yes, definitely you have to go immediately down your shelter. And please try to understand the amount of radiation exposure: 50 to 70, 70 to 150, 150 to 300, around 500 or more than 500. More than 500 is almost gone. Around 500 is very very bad. Around 300, yes, 150 to 300, it's almost one third of the patient will be having the symptoms. And 70 to 150, definitely it's bad, but you will be recovering from it. And 30 to 70 exposure also, you will be able to recover from that. And please make sure that you have the medications for your loose motion, for your vomiting, for your weakness, for your pain, for your burn management, wound dressing, wound cleaning. These things are very very important. And also there's something known as, if you have a exposure to this, right, you might be having cancer of your thyroid, right? So we do not want the thyroid to absorb the activated form of radioactive what is that, iodine. We do not want that thing to occur, right? So this is what where I wanted to share with you guys. And please be safe, and do look out in other online sources which are very more expert in this manner. You can even talk to some nuclear scientist, or who's a scientist, or who have an experience of working with all these things, or some military person, definitely they'll give you better idea about all this information, much better than what I can give. All right, so thank you for watching. I'll see you in the next video.